Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, hearing loss is a very common problem in today's world. It is important to discuss this problem as it is often ignored. Creating awareness amongst the people is important as it affects people of all ages, from newborn to adults, equally affects males and females and may lead to depression, dementia and other psychosocial problems. So, to discuss on hearing loss, we have with us today Dr. Bikash Choudhury, Senior Consultant ENT from Health City Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken is hearing loss, and we have often seen that people try to ignore this problem. So, we will talk about what is the reason behind it. But first off, what is hearing loss and how big this problem is?
Yeah, thank you so much. So, hearing loss is inability to hear properly. That's what we call hearing loss. So, if you consider as a problem, so it is a very, very big problem in today's world because like other chronic diseases, other lifestyle diseases, even this hearing loss, the incidence of hearing loss is increasing across the world.
Okay.
So, if you consider the global scenario, like the last statistics of WHO, it says that 10% of the total population of this world have some hearing disability.
Okay.
So, if you consider the Indian scenario, 300 persons every 10 lakhs population have some hearing problem.
Okay.
So, again, like it is very, very alarming, like every year 27,000 children are born deaf. So, if you consider the overall scenario, it is alarming in a sense. And the recent the publication by WHO, it says that by 2050, we'll have 2.5 billion people across the world with hearing disability.
Okay.
So, that accounts for approximately 1 in 4 persons. So, if the same scenario prevails, so in 2050 we'll have 1 in 4 persons having hearing disability.
All right, so these are some of the figures, and just to tell our viewers that our numbers are flashed on your television screen. So if you have any queries regarding the topic we are discussing at this point in time, please call up and ask your question. Now, Doctor, coming back to you again, there must be certain common causes for hearing loss. So what are those common causes, Doctor?
So, before going into the causes of hearing loss, now, like first we need to understand how we hear. So, to hear something, we need a source of sound. The sound travels through our ear. So, ear has 3 compartments.
Okay.
It's like train, 3 compartments of a train. So, the first compartment that is outside is called external ear. Then it comes the middle ear, then the internal ear.
Okay.
From there, the nerve carries the signal to the brain. So, sound wave enters from the external ear, it hits the eardrum. Then there are 3 small bones that transmit those sound to the internal ear where there's a hearing organ. From there, the nerve carries that signal to the brain and we hear.
Okay.
So, any deformity in this pathway, because it's a chain of events, so any deformity in the pathway will cause hearing loss. So, it can be in the external ear, it can be in the middle ear, or it can be in the internal ear.
Okay.
So, accordingly, like we have 3 types, basic types of hearing loss. The first one is called conductive deafness.
Conductive deafness.
Yeah. So, that means there is some problem in the conduction of sound.
Okay.
As I told you, these 3 compartments, the first compartment external ear and middle ear, if there is some deformity in these two compartments, they usually causes the conductive deafness. Then internal ear problem leads to a type of hearing loss which is called sensory neural. Basically, it is to do with nerve, with a nerve. And there's a third type which is a mixture of both. So, it's a mixed type of hearing loss.
Okay.
So, these are the basic types of hearing loss. So, if you consider the main causes, the causes starts say from the initiation of pregnancy till our adulthood.
Okay.
So the prenatal period before the baby is born, there are certain factors that causes hearing loss in future. Like the mainly two important causes, like first one is your the genetic causes. As we all know, these are genetically genetically modified diseases. So the genetics is one.
Okay.
Second is intrauterine infection. When the baby is inside the mother's womb, there's certain infection like viral infections. Basically, the cytomegalovirus is one, rubella is one, which causes hearing loss in the baby. So after that, the baby is born. During that period, immediately after birth and during birth, there are certain factors that causes hearing loss.
Okay.
There's a condition called birth asphyxia, like during the birth process of the baby, if the oxygen level in the brain decreases in the baby, so that may lead to certain kinds of hearing loss.
Okay.
So trauma during birth, so that also can cause hearing loss. Immediately after birth, if the baby suffers from infection, that infection also may lead to hearing loss. The baby after the baby is born, sometimes the baby has jaundice. We call it neonatal jaundice. So that also can cause hearing loss.
Okay.
So these are the conditions like immediately after birth. Then the child goes into their childhood. So during that time, like ear infection, trauma, sometimes the child can put something in the ear, some foreign objects. So that also can cause hearing loss. Sometimes some genetic diseases, we call them as syndromes. They come together. It's hearing loss together with some heart defect. There can be some other anomalies. So they forms a syndrome that also can manifest in the early childhood.
Okay.
So there are some other causes, like if there is water or fluid collection behind the eardrum, that also may cause hearing loss.
Okay.
That's about childhood. Then comes to adulthood. So as we grow, then we are exposed to so many other things, like other diseases also sets in, like diabetes, hypertension, stroke. These all can cause hearing loss. Okay. So, and one of the very important thing that maybe if we have time we can discuss it later also, like is the noise-induced hearing loss. We that also is very important. These days we are more talking about that. So during adulthood that sets in. There's age-related hearing loss. Like we have seen our elders, like when they grow old, like hearing decreases. So that
different
also
section
is there.
of people suffering from hearing loss.
That is there. So all these things comes together, and these are the main causes of hearing loss.
Absolutely.
There are certain causes that affects throughout the life from birth till a date that can cause. Sometimes the simple thing like wax, ear wax, that also causes your hearing loss.
Okay.
Sometimes these are lifestyle diseases like diabetes, prolonged diabetes, uncontrolled diabetes also can lead to hearing loss. And of late, like that incidence has been increasing. I think after COVID it is increasing. This is called sudden sensorineural hearing loss, where suddenly someone can become deaf. He gets up in the morning, he hears a popping sound in the ear. Usually it affects one ear, popping sound in the ear, and within hours he is deaf.
So sudden hearing loss.
Sudden hearing loss. So that is again to be considered.
What is the reason behind this sudden hearing loss, doctor?
See, most of these cases,
is this a trauma or any?
Yeah. So here the role of awareness comes. Like if you feel a fullness in the ear while getting up in the morning or during the day, or suddenly you are losing hearing, or you hear some abnormal sounds in the ear, you should immediately report to the emergency department of a doctor, of a hospital. So most of this sudden hearing loss, we don't know the cause. These are called idiopathic. Suddenly the nerve becomes weak and the person loses hearing. But why it is important to go immediately to a doctor is because, like, if they present early, the chance of recovery is very, very good. Nearly 85 to 90% of patients, they recover the hearing.
The early the problem is diagnosed, the treatment also starts
yes,
at the
yes,
earliest, isn't
yes,
it?
yes.
Now, doctor, there must be some basic symptoms also with the person will come to know that when the person has to go and see and immediately to an ENT. If we talk about children or adult or elderly people, there must be some symptoms. If we talk about children, now children are very difficult to judge. We can't understand what exactly the problem they are facing. So if we talk about children, how careful a parent will have to have?
So before we discuss about the children, let me tell you one point. Like this hearing loss in adults is mostly ignored.
Okay.
Or there's a sense of they don't accept. First of all, if you tell someone that, okay, if you observe someone that he's hearing less, if you tell him, like first thing he will not accept, he will just ignore. So in adults, if you see, if we observe a person, if he is increasing the volume of the TV, if he is staying aloof, like if he is not mingling with people, he is avoiding noisy surrounding, he is asking the other person to repeat what has been spoken, repeat things.
Okay.
So these are the earliest signs of hearing loss.
Hearing loss.
If you talk about children, like up to 6 months, say if the child doesn't respond to sound, say if the child doesn't startle, after 6 months, if he is not turning his head towards the source of sound, if you're calling and if he's not turning his head, then we should think about some hearing problem.
Okay.
When the child grows, say become 1 or 2 years or 6 years, that time, like if there is dissociation, like if he is not attentive, then we have to suspect, the parents have to suspect that the child must be having some hearing loss. One important point here, which I missed out, like these children, after they are born, they should go a initial hearing assessment within 1 month. That is mandatory. The initial hearing assessment of a child should be done within 1 month of birth. If that screening test shows some positive, then the parents needs to do a complete evaluation within 3 months.
Okay.
Yeah, because
so
most of these hearing problem in children, mostly they are preventable and they are treatable as well.
Okay.
So early diagnosis and early intervention is the key.
Absolutely. Doctor, we'll have more conversation, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic hearing loss. Now, Doctor, coming back to you again, earlier to the break, we had an idea about the basic causes and what kind of like symptoms do a person will get to immediately go and see an ENT. Now, if we talk about the sudden hearing loss, is it treatable, Doctor?
Yeah, it is. It is treatable if they present within that specified period. Normally, an adult person having a sudden hearing loss, we advise the patient to report to emergency department of the hospital as soon as possible.
Okay.
So within 3 weeks, if we can intervene, the chances of regaining normal hearing is almost 85 to 90%. So, but if they present after 3 weeks, it comes down to 40 to 50%.
Okay.
So you can see the difference. Like if they come early, there's chance that with medication we can treat them.
Okay. Now, what is the diagnosis part? If we talk about that, what kind of test is being conducted on the person, be it anyone who comes with a problem?
Say any person coming with a hearing loss, the most important to do a thorough clinical evaluation by a ENT specialist. Initially, we clinically evaluate the patient. After evaluating the patient, then we subject them to a certain test.
Okay.
One of the most important tests that we do is called audiometry test, where we can find out, like as I told you, what type of
compartment.
What type of deafness the person
Deafness
has,
person is
whether
having.
it's a conductive one, it's a sensory neural, or a mixed.
Which is the common one seen, doctor?
Both are equally common
Okay.
because it depends from person to person and what disease they have, underlying disease. So, both are equally common. So, the audiometry test is one thing. Then there are certain other audiological evaluation also we need to do. And certain patients we may subject to radiological imaging also, like CT scan or MRI also. So,
All right. So, doctor, we have seen our grandparents and also our parents also like having a decreasing of hearing. So, is it normal? Is it a normal in this kind of age?
it is normal as well as it is common.
Okay.
With growing age, losing hearing to a certain percentage is it's a common thing, and most of the time it runs in families. So it is genetically mediated also at times.
Okay.
So as the person grows, so the hearing cells or the hearing the organs, it also ages. So as a part of this aging process, we lose certain percentage of hearing. In some persons, it can be little premature. It should say normally after 75 years, the person should be losing certain percentage of hearing. But sometimes it is little premature. Sometimes what happens in males, it sets in early. In female, it is little later. So this kind of differences are there. So it's a normal thing, and we call this condition as presbyocusis.
All right. So, doctor, is there anything to relate with any kind of shock a person has had in his life, and that has also created a hearing loss? Is there anything to relate with that?
See, emotional trauma.
Emotional trauma.
Yeah.
Okay,
Emotional trauma can affect the whole nervous system at times. So, hearing also is a special organ. It is related to the nervous system, but directly we cannot say that all emotional trauma will lead to hearing loss.
Okay. Now, gadgets, phone, mobile phones we have seen. So, does mobile phones, viewing of mobile phones and like hearing with the headphones or the earphones also affect the hearing, doctor?
Yes, of course. This is the most burning problem what we face today.
Yeah.
We are all in a very, very mechanical world.
Overuse of mobile phones and all.
40 years back, the world was totally different, and now it's totally different. We are all surrounded by machines. And as you know, all machineries, they produce certain sounds. May it low frequency or high frequency, there will be some sound. So our ambient noise has increased. Like if you go to the streets, there will be lots of vehicle plying, the horn. Like if you come home, the sound of refrigerators, sound of AC, all these are, we are exposed to certain levels of sound. To add to that, like we are every day we are using mobile phones. That's one thing. Personal audios, like either we use the headphones and all. So these all causes noise exposure.
Okay.
When it goes beyond permissible limit, there are certain permissible limit, and beyond that, it definitely causes hearing loss. See, for example, if I told that the headphones at the lowest possible volume, the maximum permissible period is 60 minutes to 75 minutes.
Okay.
But if it is beyond that, it's definitely going to hamper your hearing.
Okay. Now, doctor, we would like to also get a tips from you as well, because like we being in this field, we have to use these earphones for quite long hours. So on that note, what tips you would like to give us? Because we hear a multiple number of sounds and we have to give a focus on everything. So on that note, what tips you would like to give us? Do we need to change our sides like of our ears and put the earphones on the other side?
See, the tip will be use it within the permissible limit.
But that's not possible for us.
That if it is not possible, you have to put the volume at the lowest possible settings. Use a binaural earphone. Like it should not be in one ear. So you have to use both the ears. So that is one thing. Secondly, as far as possible, remove it when it's not in use.
Okay.
So these are the things like you have to follow.
Okay, so these are some of the tips, and it's also upon us, like if we are using earphones and headphones, like the number of, the maximum number of sounds or what we can adjust according to our, but what we have seen that the overuse of mobile phones is also being seen nowadays in kids. So that has also hampered, maybe because of these things, the parents will have to keep an extra care on that note, isn't it?
Yeah, as I told you, I think this point should be discussed again. We are talking about children.
Yeah, children.
So the prevention of hearing loss in children, there are few points that I think we all should remember. The first thing, during pregnancy, it starts from pregnancy. During pregnancy, the mother should do a proper antenatal checkup with the anomaly scan. After the child is born, he should go for hearing screening within 1 month, that I have told you.
Okay.
Third is going for the proper vaccination. Fourth is try to keep the child away from electronic toys that make sound. That's very, very important. These days, like previously we should see the toys, the electronic toys, it makes some sound. These are all high frequency sound. It definitely affects the ear of the child. Now we see the children, after once they become 2 years, 3 years, they play with a mobile. That also is not very good. It's not good for your hearing. It's not good for the eyes also. So then there are other cognitive problems also together with that. So the children's, I think, although we are in an electronic world, it's all in our hands.
Okay.
It's not that the machine will not tell me how to use it. So we are the base judge. We have to judge it accordingly. Say it's up to the parents how they keep the children away from these electronic toys.
Or to fix a routine. A routine measure can be taken up.
Fix a routine. That's important.
Okay. Now, doctor, when the diagnosis is done, the treatment starts according to the problem the person is facing. Now, if we talk about the treatment procedures, we have seen nowadays that like hearing aids are available in the markets. How important or how effective are these hearing aids?
So again, the treatment part differs in children. Treatment as well as the approach is different in children and in adults.
Okay.
In children, the kids born with hearing deficit, so we subject them to a complete evaluation, and the treatment will be the key to all treatments will be early diagnosis and early intervention, which I have already mentioned. So the modalities of treatment are again technology driven.
Okay.
So we have hearing aid, as you said, certain children will benefit from hearing aid. So hearing aid, what it does, it amplifies the sound. It's like a speaker near your ear. So it amplifies the sound and it delivers high volume sound to the ear and the person hears.
Okay.
With some residual hearing. There are, beyond that, there is something called cochlear implant.
Okay.
Which is like we implant a device inside the ear or behind the ear.
Okay.
So it directly connects to the hearing nerve. So the signals will be directly transmitted there. Say now the hearing nerve also is not functioning, so what we do?
Okay.
So there is something called a brainstem implant. So we directly implant a hearing device into the brainstem. So these are the new technology and new procedures that's been done in children. In adult as well, like a person having, as I told you, age-related hearing loss, there maybe the simple hearing aid will help.
Okay.
So it's all depends how much functionality is required and how much precision is required. So these two aspects will be considered while offering treatment. Adults mostly like sometimes surgery. In case of, as I told you, there is a middle ear compartment.
Okay.
So if there is infection in the middle ear compartment and all the ossicles, the small bones are destroyed, or there is infection setting in that case surgery helps.
Surgery helps.
Surgery helps.
Okay.
So it all depends because there are maybe 100, 200 causes of hearing loss. So the treatment also depends on the cause.
Okay. So what are the preventive measures after the surgery, doctor, when the person goes back home? What are the advice you give?
Surgery, again, as I told you, there are different surgeries done for different diseases. So, but again, we'll tell there are a few general advices that we give. Say avoid exposure to noise.
Okay.
So protect your ear, what we say. Like any person, whether he underwent surgery or his hearing is normal, we have to protect our ears.
Protect
like
the
we
ears.
protect our eyes, we need to protect our ears.
Okay.
So if we are in a loud environment, these days we go for party, we go for DJ shows and concerts.
So that might affect.
These are all high decibel sounds. So there using a
Okay.
earplug will help if you're going to a noisy. So as we wear sunglasses, so
We need to protect our ears as well.
our ears as well.
Doctor, we are really short of time. So
Yeah.
what tips or message you would like to give our viewers who are watching our show?
So I'll again tell our viewers, like you have to protect your ear. How you protect your ear, you have to avoid noise, exposure to noise. So whenever you are going to a noisy environment, please make sure that you use your earplug. Secondly, don't take medication without advice from doctors. There are many medications that may affect hearing. So starting with antibiotics mostly. So without doctor's advice, please don't take any antibiotic. The third point to the parents, if you see your child is devoid of attention or you suspect that he is having some hearing difficulty, please go and consult the doctor at the earliest.
All right. Thank you so much, Doctor, for this lovely message. I'm sure the viewers who have watched our show must be benefited with the answers. And with this, we have come to the end of the show. And we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.